Hello, it's Dr. Eric Fate at the Elite Health Institute, where we discuss all things related to health and hormone optimization, genomic medicine, lifestyle medicine, true precision preventive medicine. So, thanks for coming to our page. I want to give a quick introductory video on a couple of topics, series we're going to go through. But one of the things that comes up and I want to explain to our patients and clients is that normal is not optimal. A lot of times patients will come to us seeking health optimization. They want to feel better because they've been somewhere. They've been to a coach or their family doctor or another clinician or provider, and they just don't feel well. They're tired. They're gaining weight. They just don't feel right. They're moody. They're cranky. They're irritable. They're not losing the weight they want to lose. They're losing their sex drive. Relationships are suffering. They're just tired and cold, fatigued, having gut issues. Guys, ladies, does that sound familiar? I mean, is anybody having those symptoms? I know a lot of people are because I see them all the time. But anyway, they go and they come in and get checked, and they may go somewhere and they get some lab work done or an examination. They say, well, everything's normal. Don't see anything wrong. So here's some Prozac or go lose some weight or whatever. And then they're kind of like, well, now what do I do? Well, that's the thing. It's not always the case. If they're having symptoms, if there's something wrong, we need to dig a little deeper. Just because certain things are normal doesn't mean things are right or correct or optimal. There's a huge difference there. And that's the difference between normal and optimal. That's when we talk about with health optimization, certainly with hormone optimization too. Normal is not always optimal. There's a normal range, but it doesn't mean it's the best for you. Back, hundreds of years ago, clinicians and physicians would basically treat the patient. We didn't have all this fancy lab work and diagnostic tests. So if someone had certain symptoms, they figured out what was causing it and how to fix it, and they would treat them. For example, thyroid didn't have the TSH testing and this back in the day. They had a lot of symptoms which they compiled through hundreds of years of data and observation. Then when they treat them with thyroid hormone, they would get better. They would treat them until their symptoms improved. Same with other medications and other conditions. And then unfortunately, we've kind of gotten away from that in medicine. We've lost the art of touching our patients and examining them and asking questions and seeing how they respond. We've gone to this laboratory method now where we check all these lab work, and if it's normal, we let it go. Well, we treat the patient. We don't treat a piece of paper with numbers on it. So I always say it's like the difference between an A student and a D student. So for example, testosterone is a classic example, right? The quote unquote normal range is of a blood work of testosterone levels anywhere from 300 to 1,000. So if you come in at 301, well, you're normal, right? That's what you're going to get told, but it's the low end of normal. We want to be at the upper end where we should be. Similar, if you did lab work on patients when they're in their 20s and 30s, they're probably going to be up to close to 1,000. That's what we want to do. We can't stop aging or truly slow. We can slow it down a little bit, but we can kind of regain some of our youthful vitality. I'll talk about the benefits of hormones in another video and how it can optimize our health, because it's not that we're cheating and we're not turning back the clock, but we're kind of improving our metabolism and hormones because they do have numerous health effects on our body. And by doing that, we can make our health better, because that's what we're losing as we age, because cells in our body are just not working as efficiently. So we can make them work more efficiently, kind of regain what we've lost and slow things down a bit. So again, if your levels are at the low end, you're kind of in that normal range, but we want to be optimal. We want to be an A student versus a D student. What I mean is that, if you're passing a class and you get an A, you passed, right? But if you get a D minus, you're still passing in class. You didn't fail it, right? But I don't know about you, but I don't want to be a D student. I want to be an A student. Same thing with your health. It doesn't matter what your numbers show. If you're having symptoms, you have the condition. These numbers are based on population data. I mean, they gather them over dozens and hundreds of patients, and they kind of see who's got the low end norm. They kind of plot on a graph. Well, there's a ton of individual variation. Again, someone at 500 may feel terrible. Another one at 500 may feel great. If you break down those graphs and all these people and these ranges of lab work, some people are going to, everybody fits in everybody's different. Everybody fits. You can't lump them all together, especially when there's tons of variations and inaccuracies and errors in data accumulation and things like this. So the whole point is that just because your numbers are normal, it doesn't mean it's optimal. We want to be optimal. We're going to treat you until you feel better, and then we'll look at the lab work. We use the lab work as a guide. So that's what I see, and I see that all the time, and I treat the patient. And again, I use the numbers as a guide. I don't use that to make my decisions for me, and they work hand in hand together. So getting back to the way medicine was done many, many years ago, which was highly successful and very well, people felt better. They lived stronger. They had less infections. They had better sex lives. They lost weight. Feel better about themselves, better mood, better clarity, better energy. That's what you want. That's what you want. We're going to optimize your body and optimize your health, get you living longer and better so you could spend more time with your family, being productive at work, whatever it is that you're doing. So guys, if you want to learn more, sign up for a free consultation. Click the link below or go to our website and find out how to come in for a consultation and get some evaluations done. And let's get your health optimized. Thanks for watching, and we'll talk to you soon.